In this video presented by Overpsyched, we are going to review Narcissistic Personality Disorder. I'm Dr. Gerald Richardson, and let's begin with the objectives. We will first discuss the diagnostic criteria, then cover some of the common features. We will then compare narcissistic traits from the disorder, then review the prevalence, development, and course, and conclude with our current understanding regarding treatment. The DSM, or Diagnostic and Statistical Manual of Mental Disorders, defines narcissistic personality disorder with the following diagnostic criteria: a pervasive pattern of grandiosity in fantasy or behavior, need for admiration, and lack of empathy, beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. 1. Has a grandiose sense of self-importance. For example, exaggerates achievements and talents, or expects to be recognized as superior without commensurate achievements. 2. Is preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. 3. Believes that he or she is special and unique and can only be understood by or should associate with other special or high-status people or institutions. 4. Requires excessive admiration. 5. Has a sense of entitlement, that is, unreasonable expectations of especially favorable treatment or automatic compliance with his or her expectations. 6. Is interpersonally exploitative, that is, takes advantage of others to achieve his or her own ends. 7. Lacks empathy, is unwilling to recognize or identify with the feelings and needs of others. 8. Is often envious of others or believes that others are envious of him or her. And 9. Shows arrogant, haughty behaviors or attitudes. So now let's summarize some of the common features. Individuals with narcissistic personality disorder are often described as arrogant, overly confident, conceited, or disdainful. They also have a sense of grandiosity or exaggerated sense of self-importance. They tend to boast and overestimate their abilities. They have a very fragile self-esteem. They need constant admiration and may fish for compliments from others. And because of this fragile self-esteem, they are very sensitive to criticism and defeat or failures, and they may react with a defiant counterattack to criticism. They are more likely to react with anger or aggressiveness when presented with rejection. They're prone to feelings of shame or humiliation, which could lead to some social withdrawal. Their performance at work may also suffer due to being unreceptive of feedback. They also have a lack of empathy and tend to have difficulty recognizing the feelings of others. They may not recognize how their words may hurt others. They may devalue or criticize harshly the success or contributions of others in order to highlight their own achievements. They may monopolize conversations, and they often have fantasies of unlimited success or power. They believe that they are superior to others, and they often demand only the best or top person. For example, if they are in the hospital, they may demand only the chief attending be the one who takes care of them. And finally, their interpersonal relationships frequently suffer. Now let's take a moment to discuss the difference between narcissistic traits and the personality disorder. So many individuals may display narcissistic traits. This is especially common in those who are high achieving or very successful. However, using the diagnosis narcissistic personality disorder is only appropriate when these traits are inflexible or persisting and maladaptive, causing significant functional impairment. Overconfidence, arrogance, etc. does not always indicate narcissistic personality disorder. So now let's discuss the prevalence, development, and course of narcissistic personality disorder. So narcissistic traits may be common in adolescence. This does not necessarily mean that the person has the personality disorder. The cause of the disorder is not exactly known, as is with most personality disorders, but it may be linked to trauma. The prevalence depends on the study, but estimates range from less than 1% to up to 6%. And it is observed more frequently in males than females. Now, in terms of the course, aging may be more difficult for those with narcissistic personality disorder, as they lose their perceived benefits of youth. And some of the common comorbidities that are observed are persistent depressive disorder, also sometimes referred to as dysthymia, major depressive disorder, anorexia nervosa, substance use disorders, and other personality disorders such as histrionic, borderline, antisocial, and paranoid. And on a related note, as we just discussed, one of the common features of narcissistic personality disorder is grandiosity, or an exaggerated sense of self-importance. Grandiosity is also commonly seen in mania or hypomania. However, these are associated with changes in mood and functional impairments. And narcissistic personality disorder tends to have more of a lifelong presentation, whereas mania or hypomania is more episodic. This can help differentiate mania or hypomania from narcissistic personality disorder. Next, let's review some of the subtypes. These are not described in the DSM, but Theodore Millen described a few subtypes that you may encounter. First is unprincipled narcissist, which includes antisocial features. These individuals are characterized by fraudulent, exploitative, or disloyal behavior. Next is amorous narcissist, which includes histrionic features. This is characterized by erotic, enticing, clever, or lying. Then there is compensatory narcissist, which includes negativistic or passive-aggressive and avoidant features. It is characterized by admirable, exceptional, and a fixation on being superior. And finally, there is the elitist narcissist, which acts privileged and entitled. Now let's move on to discuss treating narcissistic personality disorder. As is with most personality disorders, therapy is difficult, as individuals don't typically view their issues as being symptoms. Recall from the video, The Introduction to Personality Disorders. Personality disorders are what we call egosyntonic, meaning individuals don't often recognize the problems with their behaviors. People rarely seek help due to the personality disorder, but they may seek help when it creates difficulties in their lives. So comorbidities such as major depressive disorder or substance use disorder may be the main motivator for these individuals seeking help. Psychotherapy is the primary mode of managing narcissistic personality disorder. Commonly used treatments include transference-focused therapy, metacognitive therapy, and schema therapy. Psychotropic medications are typically not indicated unless there are comorbid mood, psychotic, anxiety, etc. symptoms. This concludes the review of narcissistic personality disorder. Thank you for watching, and be sure to check out overpsyched.com for more resources.